Hey guys, first off, I just want to say, please ignore the way that I look because I look deformed, like a deformed creature that just crawled out of the ocean that is drowned or something. I don't know, not know. Just ignore that. So, this is Shawna Maynard from Sheldon Clark High School, and I decided to do my informative speech on this evil disease called cancer. Some of the different types of symptoms, of the different cancers, and how can we prevent this disease from taking over our lives. So, first off, let's start with a very common type of cancer in women, which is breast cancer. Breast cancer is a malignant tumor that starts in the cells of the breast. A malignant tumor is a group of cancer cells that can grow into surrounding tissues or spread to distant areas of the body. Breast cancer mostly occurs in women. However, men can also develop this disease. Breast cancer cells can enter lymphatic vessels and begin to grow in the lymph nodes. If the cancer cells do spread to lymph nodes, there's a very high chance that the cancer has spread to the bloodstream, causing it to spread to other places in the body. The more lymph nodes with breast cancer cells, the more likely it is that the cancer may be found in other organs as well. And because of this, finding cancer in one or more lymph nodes often affects the treatment plan. Early detection of breast cancer and monthly mammograms definitely improves the chances of surviving it. If the early detection is made, professionals can help them understand their treatment options and help them cope with the physical and emotional side effects, because believe me, there is probably very many. Some symptoms of breast cancer are lumps in the breast, bloody discharge from the nipple, and changes in the shape or texture of the nipple or the breast. Now, let's talk about leukemia. Leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. There are many types of leukemia that exist. Some forms are more common in children, while other forms are more common in adults. Leukemia usually involves the white blood cells. Your white blood cells are infection fighters. The body needs them when you get sick to fight off whatever you may have. They normally grow and divide in an orderly way as your body needs them. But in people with leukemia, the bone marrow produces an abnormal white blood cell, and these do not function how they are supposed to at all. So many patients with slow-growing types of leukemia don't have symptoms, but rapidly growing types of leukemia may cause symptoms that include fatigue, weight loss, frequent infections, and easy bleeding or bruising. So, let's move this camera. Let's move on to the most deadliest type of skin cancer, melanoma. Melanoma pulls on my heartstrings just a little bit because my dad is a survivor of melanoma skin cancer. Ultraviolet UV rays are clearly a major cause of melanomas. UV rays come from sunlight, but most often the case is that they're coming from a tanning bed. UV rays can damage the DNA in the skin cells, and sometimes this damage affects certain genes that control how skin cells grow and divide. If these genes are getting affected by the UV rays, they will not work properly, causing the affected cells to form a cancer. And some of the damage might take place in a few years before the start of the cancer. And I know it sounds crazy, but most of the time, the damage is done from many years before, when children, teenagers, young adults get a lot of intense sun exposure that might not result in cancer then, but it results many years or even decades later. So, most of the gene changes commonly seen in melanoma cells are not inherited. They are more likely the result of damage caused by sunlight or tanning bed. Some melanomas occur in parts of the body that are rarely exposed to sunlight. These melanomas are often, they have different gene changes than those in the melanomas that develop in sun-exposed areas. Some signs and symptoms of melanoma are large brownish spots with darker speckles, a mole that changes in color, size or feel or that bleeds, small lesions with an irregular border and appears like red, white, blue, or black. And dark lesions are your palms, your soles of your feet, your fingertips or toes, or on a mucous membranes lining your mouth, nose, vagina, or anus. Definitely stay out of tanning beds. It is one of the biggest factors that cause this deadly disease. And I'm guilty of getting in tanning beds myself. And I really shouldn't because it runs in my family, but it is one of the biggest factors that plays a role in getting this skin cancer. So seriously, stay out of them. Lastly, I'm going to talk about lung cancer. These 4 cancers are not the only cancers that exist by far, but they are the very 4 common types of cancer that people get. So, lung cancer is a cancer that develops in the lungs and most often occurs from people who smoke. This is a cancer that is very deadly. Although there are 3 different types of lung cancer, the most common type of lung cancer is non-small cell lung cancer. Some very common symptoms of lung cancer are a new cough that doesn't go away, changes in chronic cough or the smoker's cough, coughing up blood, even a small amount, a shortness of breath, chest pain, wheezing, hoarseness, losing weight without trying, bone pain, and frequent headaches. If you want to avoid getting lung cancer, here's a tip. Stay away from any tobacco products. It will save your life. So, I'm going to give you guys some examples of the 4 different types of cancers that I talked about. So, let's start with breast cancer. I printed this picture off of the internet of a lady that survived breast cancer. And this is kind of what it looks like. They remove your breast. So, they are survivors. Now, let's move on to melanoma. Melanoma here. This is some stages, some symptoms, some things that happens. You know, signs that you're going to get melanoma or you just have skin cancer. The darkness in color, the evolution of the moles, if they have a certain diameter, the asymmetry of the moles. Just look for these signs. And if you find anything like this, definitely go see a doctor. My dad had something like that on his back, and it was melanoma. And let's move on to lung cancer. So, if you want to avoid getting lung cancer, take this advice. Stay away from this. I promise it will save your life. So thank you guys for watching. Please take some of the information I presented very seriously because cancer is not something to play around with.